I'm going to talk to you tonight about cancer and about perhaps a different way of looking at cancer and using cancer's Achilles heel against it to defeat it. As you know, the approach that has been going on in conventional medicine or mainstream medicine has been a combination approach to attempt to kill cancer on a number of different levels. And usually it's killing it with chemotherapy, with radiation therapy, or with surgery. That's the three things. They used to say, poison it, cut it, and burn it. And that's pretty much the approach to cancer, and that's been the approach for many, many years. And as many of you are becoming aware, this so-called war on cancer that's been going on for 40 or so years has not produced very much fruit. They say that some cancers are being defeated, but if you really look at the statistics, some of the increased longevity of certain kinds of patients with certain kinds of cancers comes because there's a lot of emphasis on early detection. So if you catch a breast cancer at a very early stage and then die 10 years later, you've had a much longer longevity than catching it 2 years before your death and dying. But sometimes there's a real question as to whether or not life is actually being extended. It may be a purely an artificial statistic based on this early detection. Now, that's not to say that there haven't been any advances in conventional treatment, but if you also look at the cancer, what I call a cancer epidemic, it's not just treatment. There are people who, in fact, do live longer, and certain cancers have been more or less defeated by conventional treatment. When we hear Lance Armstrong talk about his experience with stage 4 testicular cancer, it's very inspiring. But the truth is that stage 4 cancer rarely gets better with conventional treatment. And in fact, testicular cancer is one of the very, very few stage 4 cancers that ever really responds that way to chemotherapy, well enough to chemotherapy to be considered a cure. Testicular cancer, a couple of types of lymphoma and leukemia can actually be cured with chemotherapy. For the most part, advanced cancers do not get cured with chemotherapy. That's not been really well publicized, and I think we've been somewhat dishonest in our depiction of the current state of affairs in cancer treatment. The other really horrible thing that's going on is that the incidence of cancer is increasing all the time. Now, perhaps some of it is due to this early detection emphasis, but I do truly believe that cancer is becoming more common, and it's becoming more common in younger and younger people. And I think physicians and healthcare professionals who see cancer patients, and even just all you have to do is be a human being in today's society, having family members develop cancer, friends develop cancer, it's frightening at how young people are when they start developing cancers that used to be diseases of old age. All the research that's going into cancer, all these, Race for the Cure, Susan B. Komen Foundation, I know that these are well-meaning attempts to improve research, or improve the dollars for research for cancer care, but most of those research dollars are going right back into the drug companies who are making chemotherapy. And there are these new targeted agents that seem to have a lot of promise, but often when you really look at the statistics in the cold light of retrospect, they don't do as well as we had hoped they would do. So overall, the war on cancer is not really being won. It's not being won by us. Unfortunately, I think it's being won by cancer. There's got to be a different approach. The other problem with the conventional approach, of course, is that not only doesn't it work all that well, unless you catch it at a very early stage, surgery is curative, but not only doesn't it work very well when it's advanced, but it's extremely destructive, and the quality of life can be tremendously negatively impacted. So we have a group of treatments that's very expensive, that often doesn't work, doesn't do what it's supposed to do, especially in advanced cases, and terribly affects the quality of life. There's got to be a different way. Now, I'm speaking to you as a cancer survivor. 10 years ago, I was diagnosed with cancer. with lung cancer, which is supposed to be pretty much fatal for most people. I think there's an 11% 5-year survival rate with lung cancer overall. I was supposed to be healthy. I was a triathlete. I always was in good shape, worked out hours and hours every day, thought I ate well, didn't have an ounce of fat on me. And here it was. I never smoked, and I got lung cancer. What an experience. That personal experience gave me a completely new perspective on the experience our patients go through. And I realized during those first early months, when I was mostly confused, frightened, felt hopeless and completely helpless, that my physicians had really very little to offer me other than surgery. I had surgery, I had part of my right lung removed, and then there was talk about chemotherapy. There was talk about potentially radiation therapy. When I started actually looking at the statistics, in those days, 10 years ago, the average lifespan for patients with lung cancer was about 7 months. And with chemotherapy, it was 8 months. Well, I said, well, that's really a good bargain. Here I get a chance to get an extra month of life, but being sick as a dog for the entire 8 months I'm alive. I started to realize, and this would have been the kind of thing that I would have probably sort of blithely recommended to patients. Or you just go to an oncologist and do what he says or she says. I mean, that's a reasonable recommendation. You go to somebody who I would trust as an expert in this field. But when it came to me, obviously, I had a personal stake in this. I started really looking into the issue and found that the treatment that was available was absolutely abysmal. There was really nothing that they had to offer me at all. I said there had to be another way. Well, I'm a kind of a compulsive guy. You can tell by the 3 hours of working out every day, building up a medical practice. That's me. I just, if there's something if there's an hour in the day that there's nothing going on, I find a way to do something, some kind of compulsive activity. And so this next compulsive activity was, since I had to stop working, I was basically disabled, is I spent my entire waking life on the internet doing research, calling experts, finding data on what was available. And I started looking at the whole picture of cancer. And I really thought that we were going about it in the wrong way. Now, I didn't have the opportunity to have a research facility at my beck and call. But I started to realize that most of the research that was going on at these major facilities, most of the funding that was available for this research was coming from drug companies. So what are they going to study? They're going to study drugs. And truthfully, just as Dr. Kalapai just said, they're not all that interested in curing us. In fact, if they cure anybody, they've actually lost a customer. What they really want to do, and I'm not saying there's some nefarious little man behind these companies making calculations that they really want to kill people. But I do believe that there is a disincentive for medicine to cure patients. There is an incentive for medicine to have chronically ill patients that they can keep on treating in an ongoing way, and that subtle incentive keeps things the way it is. There's nobody really who has a stake in making us healthy. Health is not producing a lot of dollars for the healthcare system. The healthcare system depends on illness. Just think about that for a second. We don't have a healthcare system. We have a sick care system. That sick care system depends on chronic illness. The way that modern medicine has approached disease is not to look for underlying causes which may completely end disease, but actually look for treatments of symptoms, improve lab values, and that's what our sick care system does, a drug for every symptom.